So we want to know who we have here. So who do we have?
I'm Dr. Pooja from India.
Dr. Pooja from India.
Yes, I've completed my bachelor's in Ayurveda and surgery,
Wow.
and now here for doing master's in public health.
Masters in public health.
Yes,
All right. So that means you are a medical doctor.
yes, I'm a medical doctor.
Wow. You know, growing up, most of the times, I'm sorry, I'm not like trying to say that Africa, we don't have a good healthcare system. We do have, but most of the times when people are very, very sick, you hear something like the person went to India. So I believe that the healthcare system in India is very, very nice, you know?
Yes, it's very good actually.
It's very, very good, right?
Yes.
All right. Okay, so Dr. Pooja, we are happy to have you, Global Hypertension Helpline. We are so, so happy.
Thank you.
And it's good you have a doctor here because a lot of people are confused about high blood pressure. The more you look, the less you see. The more you learn, the more it's like you are not learning. So people want a solution. You know, there are so many persons that are following us that their aim is to know how they can prevent it. There are some persons their aim is to know how they can manage it because they're already hypertensive. And I'm sure you have encountered lots of persons that are hypertensive. So you're already practicing in India. So how is life like in India? So how is life like there?
It's very good, very cool going, but a little busy too. It depends on the day we get like seasonally, like when the season is like not that good, we'll be having more patients and much busy days, but it's very good, well going.
Wow, you have most patients in India.
Yes, many
Wow.
patients in India.
So does it have to do with the population or maybe
Yes, more population and then more crowded people and more diseases,
More
many contagious diseases. So obviously doctors will be busy treating that.
That means you guys might be stressed in You're always working.
Yes.
Okay, so thank you very much, Dr. Pooja. We are very, very happy to have you. So I believe that after our conversations and discussions today, a lot of people are going to learn about high blood pressure and how they can be able to manage it themselves.
Yes.
So Global Hypertension, we are an aspiring organization, but we are not yet fully an organization. We want to be an organization.
Okay.
Yeah, so we are creating awareness. So we are using different methods to teach people about high blood pressure. Not only in Africa, we are global. So there are so many people who don't know about high blood pressure. They are limited to a certain knowledge. So Global Hypertension, we are raising awareness. We want to teach people. We want people to treat this particular condition independently.
That's a very good initiative.
Yeah, so yeah, Global Hypertension Plan, we have so many agendas, you know. We are, though I'm not going to speak about the agendas here because that is not why we are here. Okay. But I think one of the agendas is awareness, creating awareness, in which we are doing now, creating awareness, telling people that hypertension is bad, just like they want to hear from you now.
Okay.
All right.
Yeah.
Okay. So I don't know, you are conversant with high blood pressure?
Sorry?
You are conversant with high blood pressure, like you have encountered most people who are hypertensive?
Yeah. I do have seen many like hypertension people over there. Like I can say that there are risk factors for hypertension. Generally, basically, you know, right? Like what is hypertension and all. Hypertension, like should I have to explain what is hypertension?
Yeah, go on.
Yeah. So basically, hypertension, it's like high blood pressure. This is the problem that people are facing. So high blood pressure is nothing but when, like, if I'll give you an example. So when the pipe and the water, right? You understand the pipe?
Yeah.
The pipe and the water. So when somewhere it is getting stressed, then the flow will be fluctuated.
All right.
Okay. Keep it aside. I'll just tell you.
No, continue. Yeah. I'm also here to learn.
So when the blood is flowing in the vessels, so when the pressure from the blood to the vessel, if the pressure is high from the blood to the vessels, and that is nothing but the hypertension, like high blood pressure, where the blood is putting much pressure in that vessel. So there are chances to get burst if you're not getting control. So if you're not controlling your blood pressure, that vessel might get bursted. Okay. You understood? Because of high pressure and all. So this is like in general, I have told you in general. So this is why people will get sudden brain strokes when they're high BP, when they say like he got a brain stroke due to this hypertension and all. So when the pressure is high, when we are not controlling it through the medicine or through the lifestyle or through the diet, this might lead to the death itself. Okay. Of long duration. So these are the complications, like that is the worst case. So to avoid this, we'll be controlling the pressure. Okay. So Basically the like normal BP, normal blood pressure is like 120 by 80 systolic pressure and diastolic pressure.
Yeah.
I hope you know this. That is the normal blood pressure.
Yeah.
And some people will be complaining of headache. This will be the like symptom, sign and symptom, like they'll be getting headache
Yeah,
like
yeah. I
frequently.
think did I say something about headache?
Yes,
Yeah, I
that
think headache is the common symptoms of high blood
yes, yes.
pressure. Yeah.
If they are getting headache or much irritation, or even if they listen to the small sound, or if someone is speaking loudly there, they'll be getting irritated and pissed off. So these are all like their mental peace is also going because of this high blood pressure. Why does this high blood pressure affect? Means that maybe because of diet, the food they eat is not like, if they're eating more meat, more non-veg, that might lead to hypertension. Okay.
Okay.
And also like if they're eating more spices, more spicy food, more salty food, all these things, like it everything should be balanced in our body. If something is getting more in the body, that leads to like fluctuations, and that leads to disease and illness, sickness and all.
Okay.
So how to control, like at least home remedy, like if we go to home remedies, like I have seen the patient like this. Even in my home, my father does this thing with garlic. You know garlic?
Yeah, garlic.
Yeah, garlic.
Yeah.
So early morning on the empty stomach, if you are eating, like you need to eat ginger first. On the empty stomach, take a ginger, piece of ginger, and dip it with a 1 teaspoon of honey, and then a small piece of ginger.
So
Eat
are we
it on empty
are
stomach.
we to grind the ginger or just?
No, not grinding gingers. The ginger is this much. You'll be getting many pieces. Just take this much of 1 inch of ginger.
Yeah.
1 inch of ginger, and take 1 teaspoon of honey. Eat
Okay.
it together.
Eat it together?
Yes.
In an
that's
empty
it.
stomach?
Yeah, on an empty stomach. This
Every
can
day?
control your every day. This can control your blood pressure. I've seen patients, like I've seen people getting over this blood pressure because of this thing. And you can also have garlic, like roasted in butter.
Okay.
Butter. Just fry the garlic in butter and eat it with your breakfast. Like that depends on age and weight of the body, and the age of the body, and that depends on the body. Okay.
Okay.
If he is like adult aged person is having like plus 40, they can take 4 garlics or 5 garlics with
4
butter
garlics.
roasted. Yeah, 4
So
garlics.
4 garlics can control your
Yeah.
blood pressure.
Blood pressure.
On
Daily
an
with
empty
the
stomach
breakfast.
too.
Yes. No. With the breakfast you can take it.
You can take it to the breakfast.
Yeah. That ginger should be taken without breakfast. Like ginger should be taken on empty stomach, whereas garlic can be eaten with just fried garlic can be taken with breakfast. This can control your blood pressure, and this is very good for your heart. Like this can also help in reducing the cholesterol. Like in cholesterol, we do have different types of cholesterol, like
Yeah.
right,
Yeah.
that which carries the bad cholesterol from heart, that which transfers from heart. This kind of cholesterols we'll be having HDL, VDL, all these things. So that is very good for heart as well, and cholesterol as well, and for blood pressure as well.
Okay, so is there any, like, what is the common sign? Maybe someone who is hypertensive, maybe the person doesn't know. So can you just tell us maybe the signs you should be expecting, an early sign the person should be
Yes.
expecting that tells this person that, come, it's like we are already hypertensive or something
Yes.
like that. Yeah.
Yeah, the signs are like headache. First thing is headache.
Headache.
This is the very commonest this thing.
Headache is the commonest.
Headache. And see, this symptom is also interlinked with the stress. I would like to say that being in long time stressed condition, that can lead you to the hypertension. You understand? So you're being in stress for long duration, like daily, and that might lead to
Yeah, but
hypertension.
people have to work. I'm sure I'm speaking for so many persons because
See,
people have to work and make money. You know,
Hypertension
yeah.
is like lifestyle disorder. That is fine.
Yeah.
So if you are managing your lifestyle well with a good diet and good mental peace and calmness, then you won't be affecting with hypertension. The good diet, the mental peace, and what you eat. If you're eating more, burn your calories a little bit more. Go for a walk. All these things you can do.
Okay, so you spoke about eating. You spoke about stress management. So is there any risk factor that is common in India now, maybe that you
Yes.
feel that leads to high blood pressure? Is there any risk factor? Because there are so many risk factors. There are like obesity, there are like kidney diseases. So maybe what's the risk factor that is more prevalent?
Hmm.
Diabetes can also lead to high blood pressure.
Yes.
Yeah,
In
so
India, like risk factors, I can say like previously it is like above 40 plus. If the age is, if they are exceeding this 40 years, 40 plus, then they are prone to get hypertension, because at that age they'll be having a lot of tension,
40
stress and
plus?
all. 40 like 40 years
40
of age.
years of
Yeah,
age.
age.
Oh,
40 years
wow.
old people will be getting, and some people will be getting 50 plus like that. But maximum like I have seen like 40 plus. If their age is 40 plus, they are
Wow.
prone to
So
get
what do you mean?
hypertension.
Like you have not encountered people that are hypertensive below 40 years?
No, now these days like maximum. Previously it is like 40 plus, but these days, because even the students are having hypertension, because students are becoming more aggressive these days. People are getting into fights in colleges, in academics. We are seeing right on the roads. Even here in the UK, we are watching here and there. And the time I see the people, like the way they react, I'll get to know like, oh, maybe he's having the hypertension. This is the way we see the people, like when you get to know into the content deeply. So in India, it's like 40 plus.
So you say that the most risk factor of high blood pressure is age in
and
India.
also if it comes to gender, I have seen many male patients, like many males are having hypertension. Because they are the one who get
males will be hypertensive because of the stress. They have to
Yes.
feed the family, they have to do a lot of things, they have to fight for themselves and their children.
Yes.
All right. Okay, so maybe you are a surgeon?
Yes.
Yeah, you have done lots of surgery.
Yes.
So is there any maybe something that has to do with high blood pressure and surgery? Have you ever done that before, encountered that before?
Yeah. Definitely, actually, definitely. Like there is like initial thing which we need to test is if we need to perform a surgery on a patient. Like if the patient does have he should go through a surgery. His BP, I mean blood pressure, and his sugar, diabetes. If he is a diabetic patient,
okay, so
his
the blood pressure
glucose
needs
levels,
to go
everything should be normal
before he goes in for the surgery.
First we need to like monitor the patient. If his vitals comes like temperature, body temperature, and his blood pressure and his diabetes, like if he is a diabetic patient, the glucose levels, everything should be in a normal range. If it is normal, then we are going to perform the surgery. If any fluctuations, we are not going to do any surgery.
Okay, so maybe as a doctor, you know, sorry, you're a doctor, so I believe you have probably met a lot of people that are hypertensive, and you have a very good knowledge about high blood pressure, and you have encountered most of them in India. So you have done lots of interventions, so many interventions. You have treated so many persons with high blood pressure, and there are strategies in which you used in performing so do you have any secret strategy in which you do these things so that people can learn from that? Or maybe, I don't know if you can just tell us the secret strategy.
I'll say you the simple things. Like if they are having the hypertension, like if it is like 140 and 150 systolic pressure, like if it is above the 150 systolic pressure, I'll just observe them. I'll tell them the lifestyle changes and food, what they have to take, and reduce the spices and all. I'll tell, and I'll ask them to come next week or after 2 weeks. I'll be keep on checking the blood pressure. If the BP is getting controlled, if it is coming below 150, like the systolic pressure, which has to be 120. If it is more than 150 initially, now I want to reduce that 150 pressure. I'll be monitoring them with normal lifestyle changes and food. Now, if it is not getting reduced with any changes, then I'll start with medications. Like the basic Telma we can give. Like there are many beta blockers and calcium channel blockers. Like there are many categories.
You say what? I heard something like blockers and others.
Yeah, beta blockers and calcium blockers. Like these are some categories in which, like that depends on the age of the patient. For this age of patient, we would prefer this category medicines. And also, like if the patient is having any respiratory issues, then we are not supposed to give beta blockers. We will prefer calcium channel blockers. It's like that. So that is very depth.
Okay, so first of all,
go into that.
Yeah, that's very deep. You know, I'm already confused. I'm not a medical doctor. You know. So what you're saying, you have just been talking about diet. I've just been talking about food.
Yes.
Is food that
secret
important
to control this hypertension? That secret I'm going to reveal. Like it's like I believe
is food that important in controlling high blood pressure? Is it that important?
Definitely. Like
you know, some medical doctors, once you tell them you are hypertensive, if they just check your BP, your blood pressure, and they see that it's high,
Yes.
They will just give you medications. They don't even want to advise you. They will just give you. So maybe I'm not saying it happens there. I'm just saying maybe the doctor is the owner of the hospital, and maybe he wants you to buy drugs from him.
Yeah,
You understand?
That's
So,
kind of business again. If you
yeah,
are
maybe
going
it's
with that,
business,
will be
bringing
rotating.
business into the health. So I think, wow, I'm surprised because most medical doctors, they don't like giving such kind of advice about diets. They
Yeah,
mostly
that is
are.
what the thing I want to introduce, like I want to spread the information is, don't be stressed. I know people will be stressed these days, but I'll give an example. Like, yeah, these days people are getting busy and they'll be wake up a little bit late. People being lazy, I can say not busy, lazy first of
Yeah,
all. That is the
lazy.
correct word. Being lazy and waking up late and rushing daily, like waking up late and then 10 minutes to the college, they'll be freshing up soon, running here and there. So their mind, it's like their brain is working continuously. They're not getting that enough calmness. So the time they enter the college, the professor will start the classes and he'll be going and he'll be mugging up in the brain, all this thing. So that brain is continuously working and it's been stressed. So
Okay.
people consider that this is not a stress. This is like, okay, I can manage. You can manage. You are thinking that you can manage, but your brain is getting burdened here, right? That has to work properly. If you're putting pressure more on it, okay, today you have continued, and today at the end of the day you'll be sleeping late, completing your things, and the next day you're rushing again. So when your brain is having continuous this rushing kind of thing, that is also a pressure to the brain. That little, like the minute things, 1 plus 1, these things pile up, and that creates the stress. Try waking up early in the morning. Okay. Try to do meditation. Like, this I have seen a lot of change in myself after getting into meditation and all.
Yeah.
So wake up early in the morning, just 15 minutes, sit calmly with the nature, or just do meditation. Talk to yourself.
Okay.
Schedule. When you wake up, schedule what do you want to do. Like, these are the things, primary things, priority things I want to complete. Just keep a timetable, or at least have the thoughts like what do you want to do.
Okay, so you're telling
and
us
just-
about stress management now.
Yes. So
Okay.
this is how you continue and have good diet, and just put your day very calm and smooth. So where is your stress in this kind of lifestyle?
Okay. Plant a lot,
Yeah, this is like very minute things, very little things can
Yeah,
change.
very little things can
Introducing-
just increase your blood pressure.
Yeah,
You know,
introducing your
there is a woman that I spoke to one certain time. She said that she began to develop blood pressure when her son pranked her. Yeah, she didn't have high blood pressure before. So when her son pranked her, though I'm not going into details for confidentiality's sake, because she might be watching. So, but she told me that her son pranked her. After the prank, she had to be hospitalized for a few days. That was how she started being hypertensive. Yeah, just like you said, little things can increase the blood pressure.
Exactly.
Yeah. So, as a medical doctor and experience, you have had much experience in the profession. So, do you think lifestyle changes is the best way of intervention or medical? There's some people prefer taking drugs. I don't know, like you're not already that alcohol intake. Poor food choices can lead to high blood pressure. Then maybe the person doesn't want to stop taking alcohol. The person doesn't want to stop eating junks and foods that are high in carbs and high in fat. The person wants to continue living his or her lifestyle, so the person will prefer medications. Yeah. So I don't know, which one do you feel like is the best, because the whole world is watching. They want to know which one do you feel like is the best one.
The
Maybe
best
you
one
have-
I would suggest is, don't go for the medications first. I would firstly tell you, like being a doctor, I'm telling you that if you are giving a tablet, that might reduce your signs and that might reduce your problem, but long-term use of the medicines might create you the side effects. That will definitely affect. Like if the hypertension patient is taking continuously the tablets, he'll be getting side effects, like he'll be developing some kidney-related issues, or some or the other way there will be side effects. So I would like to tell, just go with lifestyle changes and a good nutrition, like good food for your body. That helps. So being a nutritionist, you are here to you have to tell what is good for this hypertension.
Okay, which means in India they have different departments. the nutritionists that are there, are they well recognized in India, nutritionists?
Yeah, definitely. Like
Wow.
nutritionists, like we won't suggest any diet there. Just doctors, we will just diagnose and send them to a good nutritionist, and they have to go there and get the diet.
Okay, doctors just diagnose and send them to nutritionists. Wow.
Yeah, we will just diagnose the disease and we will be contacting the nutritionist. Can you please suggest a diet for this?
There are some places I don't want to mention. There is a country that they don't respect dietitians at all.
Is
The
it?
doctors have to do the work of the dietitian. Do
Yeah.
the work of, and it
You
makes
know
it
one thing, even if I get any disease, I won't take medicine. Like I first prefer with food. Even I have nutritionist first food, like
So food is the
nutritionist
best
fed,
medicine.
friends and all. So I'll be asking them, I'm sick with these things and these things are happening. Can you suggest me some good food, like which is like high protein content or which I have to avoid all these things. They will be having a lot of knowledge. So doctors are going to nutritionists in India, like
Okay.
to keep the body balanced and mentally stable.
Okay, so thank you very much, Dr. Pooja. I'm sorry I'm taking your time. Just have two things. I'm a curious guy, I just want to learn on a daily basis. I like learning, I like reading, I like learning. Okay, so someone who is hypertensive and maybe the person it is left untreated.
Okay.
Yeah, so what can it lead to? Is it that important to treat high blood pressure? Can't you just live your normal life without? Must you treat it?
No, he should get treated first. His blood pressure should be under control.
So what can it lead to?
Unless if it is 140 systolic pressure, that is manageable. But if it is exceeding the 150 systolic pressure, definitely he needs some medication or lifestyle change immediately. Because see, it's like when your blood is putting more pressure on your vessels, how much pressure that vessel can take? Okay, little bit. If the pressure is more, that's going to get bursted, right? So there are chances of getting stroke, brain stroke, sudden death. All these things are happening. So that is why hypertension people are on continuous medication. So once you start the medicine, you need to continue.
Just like stroke, just like heart attack, it can lead to stroke and heart attack and all those things.
Yes.
Which means people with high blood pressure, they need to be serious with their treatment.
Yeah, that is why it's better to control your lifestyle, good lifestyle, and good exercise and good food.
Good exercise, right?
Good exercise and food and exercise both are like
connected. I know women don't like exercise. I'm not trying to say that women, but
just go for a walk. Just go for a walk with
Do you exercise yourself?
Yeah, I do yoga.
What kind of exercise do you do?
I do meditation, pranayama, and yoga. I do yoga.
You do yoga a lot.
Yeah.
One day I would like to learn yoga.
Yeah, daily Surya Namaskaras are must, like morning and evening Surya Namaskaras. You know Surya Namaskaras?
I've not heard of that before. Oh. Surya Namaskara?
Surya Namaskara. In the sense,
okay,
Surya means sun and then
Namaskara. Is it Indian?
Yeah, this is Indian.
Surya Namaskaras. Yeah. Do men also do that one also?
Yeah, this is like Sanskrit thing, yoga.
Okay, another style of yoga.
Yeah.
I just like this. You know, India, they like dancing. Okay, so what advice will you give us? No, let me not say us, because I can say I'm hypertensive. But generally, people viewing, I'm still going to come to us first. But let me just go. So, someone who is hypertensive watching, so what advice you have to give to the person? What kind of motivation, like help us motivate the person? And
so, when they got to know about they are like hypertensive patient, just don't panic. Go for a good food, good exercise, and take proper rest. Don't pressure your mind that if you are pressuring your mind much, if you are much stressed, then it is going to worsen your condition. It leads to the worst conditions and all, I would say. So take a good nutritionist food, and I wish that you have to suggest some good nutrition diet which your blood pressures will under control. Even I need one diet for you. I'll talk to you later about it. So like that, just good food, good exercise, and then if it is not going to control, then just like the initial stage, you can take the initial doses of medicines, and definitely you'll be having the control. I have seen the patients who have stopped the medication because their lifestyle changes and taking good food, they have stopped taking medications also. Yeah, there is possibility to stop medications in between after diagnosed as hypertension.
All right, thank you, Dr. Pooja.
Yeah,
thank you. So what of those that want to prevent high blood pressure? So what do you have to tell them? Or what do you have to tell us? Because me, I want to run away from high blood pressure. Based on what you just said now,
stop eating non-veg. I would like to say stop eating non-veg. Reduce eating non-veg.
Non-veg?
Non-veg, like chicken, mutton, meat.
Wow.
Red meat and all.
You have heard it.
Yeah.
The doctor said you should stop eating meat.
Reduce eating meat and all.
But meat is proteinous.
Yeah, it is protein. Like you have to limited.
Limited, right?
People who are taking continuously non-veg now, they are prone to get
High
hypertension.
blood pressure. Yeah. All right. So thank you very much, Dr. Pooja.
And one more thing, sorry to interrupt.
Yeah.
And eat more fibrous food.
Fibrous food.
Fibrous
Can you
food.
please tell us, maybe you know any
Leafy
fibrous
vegetables, green leafy vegetables are all
leafy
like
vegetables?
green leafy vegetables are all like fibrous foods.
Okay.
So
All right.
eat leafy vegetables and then stop eating, like not stopping, like control your meat contents. That's it. And as being in nutrition, you have to suggest us the right.
Yeah, I'm still going to suggest that, but the stage is for you today.
Yeah.
And I'll
Thank you.
suggest. All right. Thank you very much. I really appreciate, I like your calmness, the way you're calm, explaining to us about things. I really learned a lot,
Yeah,
and I'm
thank
sure
you.
viewers also learned a lot from what
Yeah,
you just said
thank you.
today.
After watching this, you need to please consider your lifestyle and then food also. If you are not considering this, if you are just listening and leaving, there is no use.
Exactly.
So
Even me,
people should change. I wish they
Yeah.
understand the depth and they understand the consequences and do follow it for a good health and good mental peace and for happy families, happy lives, and for the happy society and all.
All right. Thank you very much. I really appreciate
Thank you.
Dr. Pooja. We are still going to, maybe one of these days, call you again so you can teach us. We want to keep learning.
Okay.
Thank you very much. On behalf of the organization, the aspiring organization, we thank you for the knowledge. On behalf of the viewers all over the world, though they're still going to comment, or personally, me, I'm very happy for honoring my invitation. Thank you very much.
Yeah, thank you. Thanks for introducing me into this organization and all. Yeah.
Thank you.
Thank you.
Thank you very much.
Thank you.
Yeah.